We hope there are a lot more parents like you out there who are open to information about HPV vaccination as an important cancer prevention tool. So now we're going to switch over to our next panel for today's event, and that is a panel with healthcare provider champions. This is a great group. I'm excited for you to have a chance to hear from them as well. So it's my pleasure to first introduce the moderator for the healthcare providers panel, Arin Parsa. Arin is a 9th grader in San Jose, California, and the founder of Teens for Vaccines, a vaccine advocacy youth organization honored by the United Nations Youth Envoy, the White House, and the media for its ongoing impact of engaging youth in vaccination conversations. So for the healthcare providers, Dr. Teo, Dr. Ramondetta, Dr. Greenhouse, Dr. Wolin, and Dr. Savoy, if you would turn on your cameras, I'm going to turn things over to Arin. Arin.
Thank you, Dr. Brandt. I am so excited to serve as the moderator for today's healthcare provider panel. So to get started, I'd like to provide a brief bio for each of the panelists who are exceptional healthcare providers, tremendous advocates, and champions for HPV cancer prevention. So Dr. Debbie Greenhouse is a pediatrician in South Carolina. She's a member of the American Academy of Pediatrics Committee on Federal Government Affairs. Dr. Lois Ramondetta is a gynecological oncologist and full professor at the University of Texas MD Anderson Cancer Center. Dr. Margot Savoy is a family physician, senior vice president of education for the American Academy of Family Physicians, and adjunct associate professor in the School of Medicine at Temple University. Dr. Deanna Teo is also a gynecological oncologist and assistant professor at the University of Minnesota. Dr. Todd Wallen is a pediatrician, the CEO of Kids Plus Pediatrics in Pittsburgh, the co-founder of Childcare Around the World, and senior advisor to the Public Goods Project. And also, you might know him from TikTok. He is Dr. Todd Wallen. All right, let's move to the panel discussion. So, we know that we must get more children vaccinated against HPV now to prevent cancer later. So, where do we start? Dr. Greenhouse, if you want to kick us off.
Sure, and thank you, and I think you are absolutely awesome. So I honestly think that where we start is by introducing the conversation at an earlier age. I think if we wait until the kids are 11 to 12, honestly, to some degree, the horse is out of the barn, and parents may already have preconceived notions, already be coming in with some concerns about things they've seen on social media or heard from their friends. I think we need to be discussing it earlier. I always introduce that conversation now by the 9-year-old checkup. I think we need to answer the questions then so that we can establish that, hey, we have the answers to these questions before they start hearing and seeing misinformation or even worse, disinformation somewhere else.
Absolutely. And Dr. Savoy, I think it would be really valuable to hear your thoughts on this.
Thank you. And I agree. I think you're super awesome. I couldn't agree more about starting the conversation earlier. I also think just making it a normal conversation. So somehow we've turned this into a really big deal, and it's not a really big deal. It's a vaccine, like all of the other vaccines that we give, and we really shouldn't be trying to make it more dramatic than that. And just like with every other vaccine that I give, I mean, I have the pleasure of getting to take care of people their whole lifespan. So I have conversations about vaccines all the time. And so we use anticipatory guidance to think about what's coming up at your upcoming visits, things that are coming down the pike. And you tell people like, hey, I'm seeing you in August, but the next time I see you, I'm going to be giving you a flu shot. The exact same conversation can happen with HPV. I'm going to be seeing you in a few months. When you come back the next time, this is the thing we're going to do. If you got any questions, go ahead and lay them on me. I can give you some information to think about. And then when you come back, we'll get the vaccine taken care of. And so I really think just normalizing that conversation will make it so much easier for everybody involved.
Absolutely. Dr. Wallen?
I couldn't add too much more to what everybody said, and yes, Arin, you rock. Also, I will stick with that. But yeah, no, absolutely starting early, just like you've heard from Dr. Savoy, Dr. Greenhouse. I mean, we start the conversation absolutely at 9, and we should view anything later than completing the vaccine by their 12th birthday as late vaccination. And I want to add that absolutely we recognize HPV as a sexually transmitted infection, but we shouldn't confuse that with requiring intercourse. And so the whole notion of intimate touching that can spread this, as little as one touch, as little as the first time, can spread the virus. That should calibrate everybody's thinking, that you're not thinking, well, I wonder if they're going to have sex. We know what teenagers do. Intimate touching can spread it. We need to get this vaccination started between 9 and completed no later than 12.
Absolutely. Dr. Ramadeda?
Oh, yeah. So I guess the last two speakers have a little bit of a different input than everyone else, because we're on the other side. We're GYN oncologists. And I was really impressed with the last panel. I think one of the things about normalizing it is making sure that people are empowered for themselves and for their kids. And that requires kind of a conversation between, for us, coming at it from GYN oncology, informing patients who are informed that their dysplasias and their cancers are related to HPV are so much more empowered to be advocates for the vaccine, for getting their own kids vaccinated, and be community leaders. So I think that the partnership for us, for GYN oncologists or any oncologist and the community, is awesome. And following up what Todd said, we can only hope that our kid has an intimate relationship with somebody at some point in their life. So protecting them is great.
Yeah, absolutely. Dr. Teo?
Yeah, so I completely agree with everything that everybody else says. And I think one thing, to add is to look at what are the barriers for people who are still refusing it. Sometimes there are things that we can overcome. I know in Minnesota, we have large refugee groups here. And we found that, there are some really good recommendations out there for how do we recommend the vaccine, and starting early and making a very strong recommendation. But for some groups, their decision-making is different. And so, we put it very much on the individual's, reduced risk of cancer. Some of the groups we work with here, it's very much about the community. So talking more about the community impact. For some groups, we've had to get community leaders, religious leaders involved, because that's how the decision-making is made. So I think especially because we know there are disparities in, who receives the vaccine and who isn't, thinking outside the box when what we're already doing is not working. How do we get other people vaccinated who are not right now?
Yeah. So HPV vaccination prevents 90% of 6 types of cancers. And there is some time between when someone should get vaccinated and when someone develops cancer. So Dr. Teo and Dr. Ramadeda, you provide care for those who were unable to get vaccinated or perhaps not vaccinated soon enough. So tell us why HPV vaccination is so important. Dr. Teo, you can start us off.
Sure. So I think, again, echoing, this is cancer prevention. And, for cervical cancer, we do have a secondary prevention strategy through screening. But even that, I think one of the parents talked about how she was treated, for precancerous changes and luckily did not get cancer. But that's a scary experience to go through. And, with any treatment that we give, there are always potentials for, side effects, for negative outcomes. And so we want to try to reduce the number of procedures that are needed to prevent cancer. And unfortunately, cervical cancer still, and, these HPV associated cancers, it's not just cervix cancer, they still, cause people to die. We have patients all the time that have these preventable cancers who die from that cancer. So the more we can prevent it, the better.
Dr. Ramadeda?
Yeah, I would just follow up on what you said. It's not just cervix cancer, it's anal cancer, penile cancer, vulvar, vaginal, oral pharyngeal, specifically tonsils and back of the tongue, and cervix. So I think that the thing that I guess I would just add is that onto what Deanna said, is that it's not just about death, it's also about fertility. We see patients all the time who sometimes have a cancer that's been caught a little too late and too early on in their life to be able to have children in the future, or a threat to their own parenting. And we're speaking specifically about cervix, but we also know that in follow-up for the starting early is that the earlier you start, and this is really well supported now from data about cancer itself, that the earlier we start, the better chance we have of preventing somebody from getting cancer. So following up on what some of the other panelists said is late is late. Late is not doing your best to take care of your patients. So starting early and knowing that we see so many cancers that have no warning signs and no vaccine and no way to prevent it. And we are, as one of the panelists in the last section said, is we're kind of blessed in a way to have this opportunity, and it doesn't come along often.
Very insightful. Yeah, so though HPV is extremely common, there is also a lot of mystery surrounding the virus, the vaccine, and how it affects our bodies. So Dr. Wallen and Dr. Greenhouse, please tell us, how do HPV vaccines protect our families from cancer, and why is it so important that more children and young adults become vaccinated against HPV?
Yeah, I think that this vaccine and this virus, for sure, it's sometimes hard for families to get their head around. And I will tell you, particularly pediatricians to get their head around, right? Pediatricians speak incredibly powerfully about diseases like Haemophilus influenza B, and Dr. Greenhouse and I can shake our heads because we're old enough to remember when we would see kids die in the ICU of these diseases, and so we can bring it up. And we even still speak passionately about polio, even though I never saw polio firsthand, but I saw people wearing braces from polio, and I didn't happen to see the deaths from it. But here's the trick, and we've heard from the two docs that work in the OB-GYN world, they see the disease, pediatricians don't. And so pediatricians, sadly, and sometimes even family practice docs, aren't as passionate sometimes about this vaccine because we don't see the disease, and it ends up happening to our patients after they leave our practice. But you've heard everybody on the panel say, including the panel before us, this is an amazing thing to say, hey, I can prevent cancer in your kid if we give them this safe and effective vaccine. But the whole deal is we don't see the disease. We're not as passionate. This virus is really good at evading the immune system and popping up decades later. So I'll stop going on my tirade and let Dr. Greenhouse do her thing.
Well, I would totally agree with what Todd just said. The other thing that I would add is that, yeah, one of the biggest questions that we get from parents is, why do we need to do this now? My kid is 11 years old or 12 years old, and they're barely even going into puberty yet, and they're not going to become sexually active anytime soon. Why do we need to do this now? And I always try to use personal experience on that. And I tell them, hey, I've got two daughters, and I made sure that both of them got the HPV vaccine. At the time, the recommendation was 11 and up. It was not down to 9 at that point. So I made sure they both got it when they were 11 years old. And quite frankly, my second daughter would not have known puberty if it hit her upside the head at 11 years of age. I mean, just totally not a clue. She was completely not there. But it didn't matter because I knew what this vaccine could do. And I knew that the younger she got it, the better protection she was going to get. So adding that personal experience with my own family, I think that has been one of the most effective ways to break down the barriers towards this vaccine, and also to make folks understand how the whole family effect plays in there. Because when I explained it to my kids in the same way, they were fine with it. They didn't have any problem with getting it at all. Even though, I mean, gosh, I'm not sure either of them even liked boys at that point.
Thank you so much. So, at what age should parents and caregivers prioritize getting their children vaccinated against HPV? So, what are some of the recommendations for HPV vaccination? Dr. Savoy?
So, I mean, the recommendation is 11 and 12 years old. You can start as young as 9. So, if for some reason you wanted to get a jump start, we're not going to fight you on it. Like, we'll happily give it to you at 9 and 10. So, that's not an issue. But we do think that by 12, you should be done, so that we shouldn't be waiting until you're 45 if we don't have to. Like, we should go ahead and get it all in that 11 and 12-year-old span, so that by the time you get to 12, you're all the way done. There's a few ways of thinking about it. So, I mean, like I say, I get the benefit sometimes of having the whole family hanging out in the room. So if you do have a parent, like in the last session, where they've had a life change, or now they're finding themselves, open to being exposed to HPV where maybe they wouldn't have been before, and they haven't quite met the very young age of 45, then they should get the opportunity to get the vaccine, and we should be offering it to them. But we should be offering it to them with the framework that, like, they're getting caught up on a vaccine that their kid could be getting now as the routine time that they should be getting it all the time. And so that you're not sort of delaying people. We're not telling you to wait till you get older. That's not the message that we want gotten out there at all. If for some reason you just happen to not get it at 11 and 12, it's not all doom and gloom. We have options for you. But ideally, up front, we want to get that done by 12 years old. The other beautiful part that sometimes people forget, I'm not one who particularly enjoys needles. I mean, I'll get my vaccines and do what I need to do, but it's not my favorite thing. When you get it early, you only need 2, and you get really amazing protection. And so there's something to be said for not having to come back for a third shot, not having to have a sore arm for a third time, not needing another visit in the office. And so doing it early really does help a lot of people, including the rest of the family, just get it done, because you only have to do 2 shots instead of 3.
Absolutely, Dr. Savoy. Dr. Greenhouse, if you have any thoughts.
One thing that I would add to that, and I totally agree with what Dr. Savoy just said, if there is a patient population that is potentially more vulnerable or potentially higher risk to not return, that also makes an even bigger argument for initiating the vaccine sooner. So like I'd said earlier, I try to initiate that conversation at 9 with the hopes of making sure that the family is going to be on board and accepting of the vaccine by the 11th birthday. But in kids where I am concerned that I may not see them again, I really, really push to go ahead and give the vaccine at 9 or at 10 or whenever I get them into my office. So certain populations, particularly children in foster care, would be a really good example of that. I take care of a lot of kids in foster care. And if I get those kids in my office at 9 or at 10, I really, really try to get them vaccinated. Sometimes that's difficult because you have to make sure you have someone there who can legally give consent for that. But if you can do it, I really think that it is in those kids' best interest to get that vaccine on board as quickly as you can. The other thing I do in that scenario is that I always put a reminder visit in our electronic medical record to generate a reminder in 6 months, hey, this vaccine is due. Now, sometimes, particularly in foster care, that child may not even be in the same home, and that reminder is going out into Never Never Land. But a lot of times it's actually getting where it needs to be. So I think we do need to be really, really careful with those vulnerable populations. Homeless children would obviously be another really super vulnerable population where we want to give it as soon as we can possibly give it.
Absolutely, Dr. Greenhouse. So, Dr. Rowland and Dr. Greenhouse, how many HPV vaccination doses are required to reach optimal protection against cancer?
I'll take it. All right. So if you get your vaccine doses started by the age of 14, you only need 2, even if you age in go above 15 for your second dose. And you don't have to restart the series. I heard during our parent panel, if you got delayed because of the pandemic or anything, you pick up where you left off. So as Dr. Savoy, who doesn't like needles, said, you only need to get 2 pinches. The key with this, and you guys all hear us saying why it's so important to get it early, is that as you've heard, almost everybody gets HPV, and there are over 100 different types, of which 40 cause cancer, of which the main 9 bad actors are taken care of by this vaccine. If you don't get it by 12, does that mean it's not effective? No, of course, you can still get it at 13, 14, 15, and over 15 and older, you're going to get 3 doses. But the key to get it is to get it before you're ever exposed to the virus, or if you are exposed, to get it as quickly as you can before you're exposed again. Even if you've had a pre-cancer or cancer, you can still get the vaccine. And as you've heard from one of the parent panelists, you can get this, it's approved all the way to 45, and I will tell you, people get it off-label past 45. It's just that insurance doesn't cover it, so you always have to talk to your doc about that.
Absolutely. Dr. Greenhouse, I think it'd be really great to hear your thoughts on this.
So, I mean, I totally agree with what Todd said. I think that is a big selling point for giving the vaccine earlier rather than later, 2 shots versus 3 shots, as long as you start before your 15th birthday. And I think that really does convince a lot of folks. The downside to that is that I absolutely have had some parents that have decided to wait until right before the 15th birthday for exactly that reason. Well, I don't want to do it too quickly. I want to wait, but I'll make sure that we do it before they need the 3 shots. I really try and convince folks that's not a great game plan, because certainly some kids are going to get exposed before they hit their 15th birthday. So I think it's a good selling point for giving the vaccine early, because anytime before the 15th birthday, it is only 2 shots. But we need to make sure that we spin that correctly so that they don't take that as permission to wait until 14 years and 364 days for the first shot.
Absolutely. And also, what are the side effects of HPV vaccination? Dr. Savoy, if you want to answer the question.
The interesting part about this one is that the most common side effect is the same side effect I see with every other vaccine, which is syncope, or people passing out. Sometimes when you get a vaccine, it causes you to have a reaction in and of itself. And so people get what they call vasovagal. It just means you get lightheaded and sometimes you'll pass out. And so that honestly is the most common side effect that I've seen. The other things that sometimes will come up, you really can get a sore arm at the spot where the shot is. And so for some people, they feel soreness. And it's possible to get a fever, although with this one, I really don't see that happen very often. So very few side effects for the vast majority of people. If you can get past that initial needle in the office and you don't pass out, you're going to be good to go.
Dr. Wallen?
Yeah, I would agree again with Dr. Savoy. This one does sting a little bit more than some of the other vaccines. That soreness that she described, spot on. And the fainting is for all adolescent vaccines. And so, and for some reason, boys faint more than girls, we find. So boys are wimpier. I don't know what it is, but yeah, you got to watch kids for 15 minutes. But that's it. It's a safe and effective vaccine, and it's cancer prevention. I mean, holy cratamoly, what a cool thing.
Yeah, so we've heard some confusion about giving the HPV vaccine before with other recommended vaccines. So is it safe for children to get vaccinated against COVID and HPV at the same visit, Dr. Greenhouse?
Absolutely. It is definitely acceptable to get your COVID vaccine, to get your HPV vaccine when you're getting a COVID vaccine, when you are getting your routine vaccines, when you're getting all of those vaccines. It is fine to combine them. And I think honestly that it's really, really super important to combine them, because every opportunity to vaccinate, if you don't take it, was a missed opportunity. And for some of these kids, especially during the pandemic, we've missed all kinds of opportunities. So we may get the kid back in for one visit to make sure that they get that tetanus booster that they need before they go into 7th grade. At least that's what it is in South Carolina anyway. But we may not get them back again. We may not get them back again for another couple of years. So if we have them in the office that day, we need to take that opportunity to give whatever vaccines we can give. And if that means giving all of the adolescent vaccines, plus the COVID vaccine, plus the HPV vaccine, that is okay. And we really should be doing that. There is no evidence that there is an increase in side effects from combining vaccines. There really has not been any problem shown with that at all. And gosh, in my office, we have given HPV vaccines combined with everything else. We have given COVID vaccines combined with everything else. And other than, as folks have mentioned before, the occasional adolescent that hits the deck, we have not seen any increase in doing that by combining vaccines. And I would agree with Dr. Wolin, boys pass out more than girls pass out. It's a thing.
100%. Dr. Savoy?
I completely agree. The only thing that I would add is that I think that people should prepare ahead sometimes, and that it's helpful if, particularly you're in an office practice where you can have some input into how the staff helps the patient schedule for their appointments. That, I mean, often if you're going to need to get more than one vaccine at a visit, they're going to put them in different spots. So maybe 2 spots on your same arm, or one in one arm and one in the other arm. So, if they have something big coming up, so that it's the day before the big baseball game, I wouldn't plan to do my visit the day before the big baseball game, so I don't cause some delay in being able to participate and do the things I want to do. You just schedule it after the game or in a different space. And so I think it helps if you have your staff able to have some of those conversations so that we pick the right day for the visit. It also eliminates some of those delays where it's not that I didn't want to get the vaccine, I just had something else planned, tomorrow or the next day. We could have worked around that and scheduled the visit a little different. And so it helps if we are sort of anticipating what we're planning to do with that next visit. That way we don't have that delay.
Absolutely. And we've seen dramatic drops in annual doctor's visits and vaccinations during the COVID-19 pandemic. And those have seen a severe decline in vital preventative services among children and adolescents, including for HPV vaccinations. So how do we regain ground, Dr. Wallen?
Yeah, get back on that horse. Get back in there and get your visits. As we've said, you just pick up where you left off if you were already partway through the series. But the earlier the better, regardless of the age. And again, to our OB-GYN colleagues, I mean, they will tell you how important this is. One of the other things on some of the panels I serve with Dr. Greenhouse and Savoy, some of the people that are most vocal at the tables when we are on like HPV roundtable are head and neck surgeons now. And they're saying, oh my God, I never want to do this surgery again, which is removing part of somebody's tongue or throat or face. I mean, think about how powerful this is. So again, if visits were missed, feel more inspired to get there and get in as quickly as you can. But this is cancer that we can prevent.
Absolutely. And Dr. Rios, it would be great to hear your thoughts on this.
So totally agree, and I would add just two things on that. I really think we need to be thinking a little bit more out of the box to be getting some of these kids caught back up, who have missed so many appointments throughout the pandemic. And I think the way that we do that is twofold. One, we need to be taking the initiative and reaching out to them, sending out text messages to folks that are behind on their well care, putting up things on our practice Facebook page that say, hey, you know, is your child behind on their shots? Come on in, let us set up an appointment for you. But we also need to think outside the box as far as what types of visits we're giving these vaccines at. So am I going to give an HPV shot to the kid that comes in with 103-degree fever and cough and congestion and testing positive for COVID that day? No, obviously I'm not giving an HPV vaccine or any other vaccine that day. But am I going to give an HPV vaccine to the child that comes in for their ADHD follow-up and is doing absolutely fine, just following up on their ADHD medicines or their anxiety medicines, or they're coming in because they got a minor knee injury playing baseball, so they're not going to be playing baseball for the next week anyway? Absolutely, I'm going to look at their immunization records, and if there's anything I can get caught up on those kids who are there for a non-acute visit, I am absolutely going to catch those kids up at those visits. And I think that's super important to be able to get back on that horse, as Dr. Wolin said, and get back to the records we have seen. I am in a learning collaborative in South Carolina, and one of the metrics that we have been looking at is our adolescent immunization rates, and they're awful. I mean, across the board, they're awful. And the reason for that is the number of kids that have missed their well child care because of the pandemic. So it really is up to us to try and utilize other types of visits to catch these kids up.
For sure. And the
Yeah.
Path to a Bright Future campaign focuses on-time HPV vaccination by the 13th birthday. So what are the benefits of on-time vaccination? For example, what do ongoing studies tell us about the importance of vaccination in preventing HPV cancers? Dr. Brandt?
You know, we've always known that getting the vaccine in before anyone was exposed to HPV was close to 100% effective in preventing dysplasia, but we had to wait a number of years after the release of the vaccine and FDA approval to prove that we could decrease the risk of cancer. And fortunately, we're starting to see those papers roll in. And the first one that really came out, there were some trends a couple of years ago, but last year in the New England Journal of Medicine, there was a wonderful article that showed not only that you could decrease by significant amounts the amount of cancer, but that if you did it earlier, your chance was, so for instance, the paper looked at like under 17-year-old, which is already late, but under 17-year-old and over 17-year-old, you reduced your risk of cancer by 88% if you started under 17, and about 50%, still good, but not great, if you vaccinated over 17. And they didn't even look at really on time, right? So we expect this to be just rolling in and us to hopefully eliminate seeing these cancers. And I'll let Deanna to comment at that point.
Absolutely. Dr. Teo, it would also be really great to hear your thoughts on this.
Yeah, no, I completely agree. And I was really excited to finally see these papers actually looking at cancer outcomes. Because like Dr. Raymond said, we had to wait a number of years till these people who got the vaccine were actually at an age where we start seeing these cancers. And so that was encouraging, and it just, you know, proved everything that we thought when we started giving these vaccines. I think the other thing I want to bring up is we talk a lot in terms of cervix cancer, because that is the only cancer for which we have a proven efficacious screening strategy. And so it's the easiest to track this in cervix cancer. But there's no reason to believe that we are not going to see the same trends in the next several years for all of the 5 other HPV associated cancers. And so again, I think that, you know, that shot, getting it early, you know, we're going to see those same trends in decreases in these other, you know, 5 cancers, the head and neck cancers, the anal, penile, vulvar, and vaginal cancers. And so I just think we need to get people vaccinated on time. The other thing is, when you're younger, it is 100% covered in this country. Everybody up to 18 has, you know, financial coverage for the vaccines that are recommended by the CDC. you can get it covered. There's different mechanisms to get it covered when you're older than that, but it's not guaranteed. And it does sometimes take some more work on the patient's part as well. So I think just, in addition to efficacy, it is covered financially, even if somebody does not have insurance, because all kids are covered for the recommended vaccines.
Sure. And for everyone now, what else would you like for the public to know about HPV vaccines? And is there one parting thought you have to share today?
And let me just prompt just one. We want to stay on time, so give us your parting prompt. Thank you.
So I would say my parting prompt would be just a quick personal story. When I was in medical school, the very first patient I picked up on my GYN rotation was a young woman from Romania with cervical cancer. She had very limited English. I spent a ton of time during that entire rotation speaking with her and trying to make sure that she understood what was going on and what we were trying to do to help her. She ended up dying from her cervical cancer, and I've never forgotten that. And I've never forgotten that if this vaccine had been around at that point in time before she became exposed to HPV, she'd probably still be here today. And that is my parting story, and that is one of the reasons I think this vaccine is so incredibly important. And thank you for inviting me to participate in this panel.
I'll jump in next. Mine's really easy. So I do not wait until after I fall off my bike to put on my helmet. And so you do not wait until after you think you're going to be exposed to HPV to get your shot. So get your shot before you think you're going to be exposed. And that means getting it before you turn 12.
Dr. Wallen?
Yeah, I'm going to come at it from the disinformation side, which is there are people out there that are selling lies on purpose, who actually the anti-vaccine industry pushes disinformation under the auspices of trying to be your friend and protecting your liberties or keeping you from chemicals, when in fact they make hundreds of millions of dollars by lying so that they can either sell you alternative products or help politicians pander. So understand, people are in a market to lie, and they don't care that they put your children or you at risk. Talk to a trusted healthcare provider, please.
Absolutely. Yeah, Dr. Ramadeda?
The HPV vaccine is safe and it's effective and it lasts and it works. Don't wait, vaccinate.
I completely agree. Dr. Seo?
I'm a cancer physician, and it is so much easier and more effective to prevent a cancer than to treat it. And the best way to prevent 6 different cancers is to get the HPV vaccine.
Once again, yeah, absolutely. So, yeah, thank you to all of our panelists for your participation today, and I will turn things back to to Heather.
Thank you so much, Arin. You were an incredible moderator for this great panel of healthcare provider champions, and we thank you for joining us today as well. So we're going to transition now to the final panel for today, the campaign's partners panel. And so I'm delighted to have representatives from 5 of our more than 70 campaign partners as of yesterday.